And this morning, Ozzy will give us some information of the health sector, obviously, the changes and what's going on with this industry. Ozzy also focuses on areas that develop partnerships within our health industry with the intent of creating healthcare career pathways, bridging the gap between the healthcare employer, community, and the LA region community colleges. He's also an adjunct faculty at East Los Angeles College, where he teaches U.S. government courses, and also is in the process of earning his doctorate in organizational change and leadership from the University of Southern California. He earned his master's degree in public administration from National University and his undergraduate degree in political science from Cal State Los Angeles. Go Eagles! Ozzy previously served as Director of Workforce Development with Alta Med Health Services Corporation, one of the fastest growing federally qualified healthcare center providers in the Southern California region, with clinics located in Los Angeles and Orange counties. Ozzy has 24 years of workforce development and training experience. He has extensive experience in creating and leveraging public-private partnerships with a focus on improving performance and delivery of outcomes. And with this, I introduce you Ozzy Lopez.
So Myrna, good morning, everyone. Myrna, you are too sweet. Thank you for that kind and warm introduction to the group. So as Myrna said, my name is Ozzy Lopez. I'm very happy to be here with you all this morning. I am one of two regional directors that works for the Health Workforce Initiative, which is under the umbrella of the California Community College Chancellor's Office. My host college is Mount San Antonio College. That's where I'm currently hosted. And my colleague, who I'll introduce and give you an overview of her in just a few minutes, is hosted out of Rio Hondo Community College. So very happy to be here with you all this morning. Would like to take this opportunity before I dive into the presentation. You know, there's a saying, it isn't the quantity or the quality, it's the quality. And we have a small group, so I'd like to see if, just very quickly so that I know who is in our group this morning, if we can do a very quick round of introductions. So is it possible, I'll just call your name, if you can just let us know who you are, if you're, what college or industry you're representing, and we'll go from there. So let's start with Arpi.
Good morning, everyone. My name is Arpi Amirian. I am an adjunct faculty with Business Division here at Glendale Community College. I am teaching the internship course during this past 2 semesters. That's why I'm very interested to know what's going on in the healthcare industry, because majority of my internship students are aiming to work in that field. So I'm very excited to learn.
Thank you for joining us, Arpi. How about we go to Nancy Medina?
Hi, good morning, everybody. My name is Nancy Medina, and I'm a career counselor at Glendale Community College.
Thank you for joining us, Nancy. How about Denise Leong Bratney? Did I say it correctly?
Yes, thank you, Ozzy. My name is Denise Leong Bratton. I am the Career Center Coordinator and also a career counselor at Glendale Community College.
Awesome, thank you for joining us. Ryan, how about Ryan Bishop?
Yeah, as said, my name is Ryan Bishop. I am an adjunct career counselor at Glendale Community College, and I had some experience doing career counseling at East LA and PCC as well.
Oh, very cool. Thanks for joining us. How about Marine Balayan?
Hi, everyone. My name is Marine Balayan. I work at Los Angeles City College. I'm teaching vocational education courses. This semester I'm teaching job readiness and job club courses. And I see many familiar and faces. I'm very glad to see you. Big hug.
Awesome. So we're having a little reunion here. That's great. How about Roxanne Rossi?
Hi, I was just sending Marin a private note. EOPS counselor, and I teach student development classes. I've been at GCC for about 20 years now.
Welcome. Thank you for joining us.
Thank you.
Shaki, Atian, we're doing an introduction, so do you mind introducing yourself to the group?
Yes, my name is Shake Atayan, and I'm an EOPS counselor. I've been with GCC for 30 years. I've started with a classified, and then I graduated and started counseling 15 years ago.
Awesome. Well, thank you for joining us. So I think we covered everybody. I don't think that I missed anyone. I really want to thank you all for taking the time to be a part of the work group or the workshop this morning. As I've indicated in the introductions, I am the Regional Director for Health here in Los Angeles. My role is to work with all 19 community colleges in all things encompassing health. And what I'd like to do this morning is provide you with an overview of, provide you with an overview of the work that we do through the Health Workforce Initiative. So the HWI, as I indicated, is under the umbrella of the Community College Chancellor's Office. And just like the various sectors that we have, there are multiple sectors, global trade, construction, information technology. Within the state of California, our HWI covers 13 regions. So we have 13 regional directors that cover the entire state, and our role is to really be that mediator of interaction between industry and the community colleges. So the map here gives you an overview of the 13 regions that we have throughout the state. So if there was ever a time, if you're looking to engage with community colleges that are outside of your region, if you have questions on projects, initiatives, or the approach that other counselors or faculty may be taking in other parts of the state, please feel free to reach out to me, and I would be happy to connect you with our regional directors. An example also of some of the crosswork that we do as a region. Currently, we are working with my colleagues in San Diego Imperial, San Bernardino, and Ventura, or what they call the South Central section, Ventura County. We're working on a six-series symposium training for behavioral and mental health. So what we're doing there is we're working with the K-12 student population and providing workshops once every 2 weeks on the various career paths that exist, from certificate training to associate level, bachelorate level, graduate level, and doctorate level. So it's a 6-series session. So that's some of the work that we do. So if you are also interested in learning what other community colleges or employers in other regions are doing, I would be able to work with you in the facilitation of that as well. This is just a quick snapshot of the entirety of the work that we do. So the collegial work gives you an overview there of all of the folks that are working excuse me, collectively to ensure that we're maximizing our career pathways for our community college students. So as I've mentioned, you could see where I fall in. I still have it there listed as a DSN, but we have the State Chancellor's Office. We have our State Director. I don't know if some of you may know or are familiar with John Cordova. He oversees the health, the HWI at the state level, and then my colleagues that I have. And a part of my responsibility also is to work with our career path specialists. So we work with our career specialists at the community college level, but also work with the career path specialists at the K-12 level. So in terms of creating a springboard from K-12 to the community college, I work with multiple school districts across LA County, where I can create that continuous awareness, and I do create that awareness of the programs. As an example here, if I heard correctly, that the staff from Glendale College or the programs that Glendale Community College is offering, as well as LA City College, among the other 17 community colleges in the district. These are the primary roles that we focus on, right? To foster partnerships and collaboration, to leverage resources among educators, government, and healthcare providers. We can offer what's called a job analysis, or it's called a DACOM, and this was a training that we received through the Ohio State University. So for the faculty or for the staff that are on board, if you are looking to upgrade curriculum or modify a job description, we can work with you in terms of going through the steps to do that modification. We can provide the assistance for that. Again, we provide assistance, technical assistance for curriculum development, revision of staff, and development testing. On the incumbent worker training side, our role has changed over the last 6 months from being a deputy sector navigator to a regional director. The one thing that's not listed on here, that from the regional director perspective, our role is to focus on industry. And so a big part of my responsibility is to identify healthcare employers that are looking that may be willing to do a couple of things. Number one is provide internships for community college programs that require clinical placements. Obviously, there are some limitations that all colleges are experiencing right now because of COVID-19, but that's the primary role. And then the second one is to create the opportunities and the linkages for employment. So as an example, I was on a call this morning with HealthNet. Some of you may have heard of HealthNet, but it's a large health plan within the state of California. They are very interested in exploring opportunities at working with community colleges to see how they can do one of two things. Number one is provide incumbent worker training, incumbent worker certifications for their current workforce. That's something that they're looking to explore, but also to look at opportunities to springboard recent graduates into the various opportunities that exist within HealthNet. An additional responsibility is to coordinate regional activities to identify and meet the workforce development needs. So again, I've touched on this, and something that I have found to be extremely important, because I've been on the employer side before, is to ensure that the needs of the employer are not just being met, but that as healthcare is continuing to change regularly, is that the community colleges are staying up to speed. So some of you may be participating in some of these advisory meetings, but I can work with you at the college to facilitate healthcare advisory work groups. So if you're looking to make modifications to a phlebotomy program, if you're looking to make modifications to a CNA program, to an LVM program, to a respiratory therapy program, as an example, I know we have LA City on the line, part of our work group today. In December of last year, I facilitated a respiratory therapy advisory group for the college, and I brought industry in. So those are things that we can do as part of our role as regional directors, is work with you to facilitate those types of workshops. And we also work on, and the last thing is we also work on providing professional development workshops. So another example that I'd like to share with you, should you be interested, this is an opportunity. In the months of October, November, and early December, we are going to be providing a diversity, equity, and inclusion training. It's 14 hours of training where if you are a registered nurse or an LVN, you'll be able to obtain CEs. But it's going to be a 3-part series on diversity, equity, and inclusion in the workplace. So this is something that if you as faculty are interested in participating in that, and currently your campus is not or isn't providing it, we're facilitating that workshop. So we do those types of workshops on the professional development side as well. So that was a long intro into what we do, but I thought that it was important to kind of give you the overall elements of the work that we do. And this is a magazine, not a magazine, a brochure that came out through the Center for Competitive Workforce that provides an overview of the high growth industry sectors. So I know that it's a little bit difficult to read, but what I will do is I will make sure that Marina, that you get a copy of the PowerPoint, that you can send it out to the folks that are attending today. But this gives you an overview of the industries that are in continuous demand. Obviously, medical assistants, LVN, nursing are in high demand. Respiratory therapists are in high demand. But one area that is growing because of COVID is telehealth. Right? So continuous training in telehealth, the healthcare industry is still looking to make modifications to what telehealth is going to look like. But they are beginning to increase the focus into telehealth career paths. Now, although we have there have been setbacks through because of COVID, the healthcare industry is continuing to rise. So the jobs that I've mentioned are continuing to increase. And I really apologize that this is looking so small for you all. I wish that I could make it bigger. But you could see there that there is a significant amount of job openings. 123 annual job openings a year. And I was on a call yesterday, and that number, although this report came out 2 years ago, I was on a conference call yesterday with us with the COE, the Center of Excellence, and they've indicated there that the number is staying constant. I believe the number yesterday was about 98 to 100,000 job openings annually in healthcare. So there's a lot of opportunity for growth in the healthcare space. And RP, you mentioned, in terms of the teaching that you're doing, a lot of these jobs are the clinical patient-facing jobs. There is a tremendous opportunity right now as well on the back end, on the health administration side. There's so much work that goes on in healthcare that is behind the scenes that doesn't get recognized. Whether you're looking at working again, healthcare administration, whether you want to be a payroll or an accountant, you want to work on health IT, there's a lot of opportunity there. I'm actually coordinating right now a workshop, a 3-series workshop on health IT career paths. So I can make sure that you also get access to that flyer. We have 2 more sessions coming up, should you want to have your students participate and learn more about health IT. And what I actually have is I have an employer that is facilitating the workshop. So they're actually listening to a practitioner on what it takes to go into a career path in health IT. This is a personal story, of Ariel Ramirez, who is a dental assistant. It just shows, that through perseverance, commitment, dedication, and effort, you can make your dreams come true. And I'm sure that all of you see that every day with the students that you work with. And I think right now, especially even more to the counselors that are on the line and to the professors, the fact that we're having to, through distance learning, right, and through distance methods of communication, keep them motivated, keep them engaged, right? So my hats off to all of you for continuing to do that work during these trying times. And this gives you an overview of some of the starting annual salaries, right? So as an example, if somebody wanted to go into, I've indicated here the management side, right? I'm sorry, this is the magnetic resistance imaging. It's so hard for me to read on my end as well, so I apologize for that. But when you get the copy, you'll be able to see it more clearly. Well, you can see here that the median entry salary for entry-level medical healthcare careers ranges anywhere from $18 and up, right? So from a starting point, students that come out of the community college system with a certificate level, with a certificate of completion or an associate's degree, can really join the workforce early on. And the good thing about the healthcare industry is that there really are opportunities to continue to springboard into the next field. So you can actually be on the job and going to school part-time or going to school full-time to continue to move up the career ladder. So there's a lot of opportunity that continues to exist in healthcare. And you can obviously, with a certificate or an associate's level degree, you can make a comfortable living or a good quality of life earning. Some of the challenges that continue as community college faculty and community college staff, you already know that these are some of the challenges that we're continuing to experience. And this is a part of my role is to work with you on, to identify faculty that may be willing to, that is interested in, or identify individuals that may be good faculty. And as an example, I indicated to you that I was with HealthNet this morning. The VP of Patient Provider, the Vice President of Provider Care, shared with me that she's interested in teaching at the community college level, and so that may be something that would be good, is to bring industry professionals that have the credentials to teach at the community college level, because there is a shortage of our understanding that there's a shortage of faculty coming into the colleges to teach, and specifically for us on the healthcare side. Working on increasing preceptorships. This has been a significant barrier for all, especially right now through COVID-19. So students that were doing their clinical placements when COVID-19 were severely impacted. But a part of my role is to identify employers that are willing to provide opportunities for internships, but most importantly, to identify the preceptors who's going to be able to sign off on that. And then working on ensuring that all programs are meeting the licensing requirements. This is an element that's been key for me, is on the employer side, is being able to report back what are the requirements that the employer is asking for if your college is interested in sending students to them for preceptorship. Not all of the employers have the same requirements. Some are more stringent than others, but what does that look like? And then in terms of managing and coordinating clinical placements for you, should that be a part. There are a lot of opportunities, right, but we don't want to tap the same well. And as an example, if we were working with Kaiser, all 19 community colleges want to work with Kaiser. Is there an opportunity to have a coordinated approach to approach Kaiser so that all of the colleges can bode well with clinical placement? These are the additional members of the team. My colleague, Shari Hirschfeld, she's a registered RN. As I indicated, she's based out of the Rio Hondo Community College. Her and I work collectively together. However, we have also separated tasks. She is leading the efforts in nursing. She's doing some extensive work right now in ensuring that the alignment of the curriculum for ADNs is equivalent to the curriculum of BSNs. Right? So they're working extensively on that. I've taken the role in my work over the last 2 years of really focusing on the allied healthcare pathways. So if we're talking about phlebotomy, respiratory therapists, laboratory technicians, dental assistants, that's the scope of the work that I do. We're both working on, we both work collectively on it, but I am prioritizing the allied healthcare career path. So should you have any questions on any allied healthcare career, please feel free to reach out to me. My information is there. Again, I'm going to make sure that Myrna gets this PowerPoint over to you, and I'd be happy at this moment to answer any questions that any of you may have.
Feel free to unmute yourself and then ask the question if you have one, or you can post it on the chat. Anybody?
I have a question. So if we're talking to a student who is somewhat interested in a healthcare career, does not want to work with patients directly, does not want to, and is not necessarily interested in tech, what would you suggest? Something that has potential and
is not interested in like health information technology?
Not interested in health information technology, but I'm thinking that some of our students may be interested in health admin, but health admin is more of a graduate level to really be competitive, right? To be in hospital management, health management. Is there a way the student can, on the way to a pretty extensive education, get a job that is not necessarily working with patients or in IT?
Well, there are a couple of things. I don't know if Glendale College offers it, but I know that at East LA College, as an example, they have an introduction to healthcare careers, right? An introduction to healthcare careers. So this kind of creates that awareness of the various paths that one can journey on should they want to work in healthcare but are not interested in being on the patient-facing side. Because as I've indicated, there's a lot that one can do. But you bring up a really good point on the healthcare admin. Typically, that's the healthcare administration is a degree, 4-year degree that or a graduate level degree that you obtain. What I would encourage you to do, and let me put it here as well. We have a website. I should have. We have a website that provides an overview of all of the healthcare careers and paths that exist. Is that for the counselors that are on, Myrna, is it okay if I share my screen again?
Go ahead. I forgot to unmute myself.
Thank you. So for the counselors that are on, this is our website. And if you have some time, I would encourage you to explore the website, but this provides a very in-depth overview of the various programs that exist, and it's good for faculty, for counselors, for students. So this provides, here for the educators, it gives you an overview of the professional development and the webinars that we have. But for students more so, it provides for you where to find the programs, or this particular one, the Health Pathway Guide. So if you click on that, this kind of can help. So hopefully this helps answer your question, Roxanne, where the student can click on this, or you as a counselor can click on this with your student and then kind of have that conversation. Another thing that can possibly work that I'd be happy to facilitate is if you are interested in providing a 30-minute workshop on healthcare pathway careers, I'd be happy to facilitate a workshop for students. So if you identify a group of students that you'd like to, are you interested in exploring a career in healthcare, I'd be happy to do a workshop with you to kind of help in terms of level setting. What path can I take?
Ozzy, would you, thank you, that was really helpful. I usually refer my students to onetonline.org, and also to Explore Health Careers. This is very good. I'm going to look this up. Would you be able to do something specifically for EOPS students?
Mm-hmm.
Perfect.
I can do something for all students. So.
Great. Thanks, Ozzy.
Thank you. And Denise, I'd be happy to partner with you guys. Again, my role is to work with you and support the efforts that you're doing as best as we can. We're here to support all 19 of the community colleges, but if there's an opportunity to do a workshop, coordinate a presentation, facilitate a workshop, if there's one specific industry that you'd like to learn more about, or you'd like to have your students learn more about, you can let me know within healthcare what that particular job would be, and I can work on bringing an employer that has the experience, that's willing to speak to the students on what the in-depth, the inner workings of the job are, to also see if that's something that really, increases their appetite in going in that direction, or it's not their taste.
Ozzy, would you be able to connect us with employers who are willing to take internship student interns?
The short answer is yes. The long answer is that it takes a little bit of time depending on the internship that you're looking for, right? Because you mentioned that you have students that are looking at going into healthcare, but not on the patient-facing side. So you're not looking at clinical placement. You'd be looking more, I would imagine, on the administrative side of an internship. So I can definitely explore that with you to identify employers or an employer that's willing to work, depending on what type of internship you're seeking out for your students. But really, it's about finding working with you to find the right fit.
Thank you.
Thank you, Ozzy. It's already 10:31. We have like 4 minutes for our next session. So I want to thank you for having us joining us today, because this information is important, and obviously our students are ready to seek these opportunities, and they want to know which path they want to lead. So I will send, once you forward me the link to the workshop, I will definitely share it to everybody so we can participate, because there's a lot of students that we can definitely serve in all of our programs that we offer at Glendale Community College. And with that, I want to thank you, Ozzy, and hopefully we'll see you soon in another workshop. And everybody enjoy the rest of your day. And if you're going to join us for our next session, then we'll see you then.
And I put my information in the chat, so feel free to reach out to me. And it was a pleasure to meet all of you, and I look forward to working with you all. Thank you very much.
Thank you.
Take care. Bye-bye.